Knock, knock, knock. Hello, my name is Morgan. I'm going to be your nurse today. Can I see your wristband, please? What's your name and date of birth?
Sean Yukawa, December 12th, 1997.
Okay, and do you know where you are today?
No.
Who's the president right now?
Donald Trump.
Yes. Okay, so my patient is alert and oriented ×3. I'm going to perform some hand hygiene right now. So first I'm going to look at my patient's appearance, and he looks well groomed, his speech is intact, he knows where he is, he doesn't look like he has any physical impairments right now. So now I would take my patient's vital signs, respiration rate, heart rate, oxygen saturation, temperature. Are you having any pain right now?
No.
Okay. All right, so now I'm going to move into my physical assessment. So first I'm going to check your cranial nerves. So can you please smile, frown, puff out your cheeks, stick your tongue out, move it right to left. Okay, clench down, clench your jaw down. I'm going to palpate your muscles right here. Okay, try to push up against my hands. Okay, perfect. All right, so now I'm going to check my patient's scalp for any skull depressions, lesions, masses, anything abnormal. I'm going to look at his hair texture, color distribution, and make sure everything is right. Okay. 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 I don't see any of the following, so that should be okay. I'm going to feel your ears to make sure that they are appropriately aligned. If I had an otoscope right now, I would look down at his tympanic membrane to make sure it was normal. Okay, so looking at his face, his eyebrows are symmetrical. Can you raise your eyebrows for me? And they are appropriately doing what they're supposed to be doing. His eyes are symmetrical, his nose is symmetrical, he has no facial drooping, his ears are symmetrically placed on each side of his head. Now I'm going to palpate your neck to see if I feel any lumps or masses. And I don't. I'm also going to feel his lymph nodes right now while I'm up here. His neck is warm pink and has appropriate capillary refill. Okay, now I'm going to ask you to remove your shirt so I can do a chest exam.
I don't know what's happening.
Yes, just so I can make sure you...
Should I stand up?
No, it's okay. You can sit down. Okay, so now I'm going to look at his overall breathing movement. I'm going to inspect his skin. It looks warm, pink, adequate hair distribution. You having any chest pain, any cough? Okay. So now I'm going to listen to his breath sounds. Take a deep breath in. Again. 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 Okay. Now I'm just going to listen to your heart sounds so you don't have to breathe any differently. So I'm going to listen to the apical over here. Looking for S1 and S2. Come over here at pulmonic. Come down to Erb's point. down to tricuspid. And finally, mitral. Okay. Now listen to your chest sounds in your back. You could take deep breaths for me. Again. 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 Okay, last set down here. One more time. Okay, his lung sounds are clear bilaterally. Okay, now we're going to do the tactile Frommius test. So I'm just going to place my hands on your back, and you're going to repeat the phrase 99.
99. 99. 99.
Okay, that is normal. Now I'm just going to place both my hands on your back, and you're going to do deep breath in and deep breath out to check for chest expansion. Okay, that was equal. His AP diameter is 2 to 1, which is normal. Okay, so now I'm going to check his circulatory status. So I'm going to look at both of his arms and his legs, and they all seem warm to the touch, pink. He has adequate hair distribution on both, no lumps, masses. I'm also going to come back up here and palpate your thyroid. Can you swallow for me? Okay, and I don't notice any bulging. So that means your thyroid is not having issues. Okay, so now I'm going to check all your pulses. So first I'm going to listen to your temporal pulse on your head. Okay, I'm going to do your carotids. And those are both a 2+, which is normal. I already checked your apical pulse. Now I'm going to check your brachial pulses right here. And those are both 2+ as well. I'm going to do radial. And ulnar. Those are both normal. I'm going to check your femoral pulse as well. That side is normal. And that side is normal. Okay, now I'm going to come down here and feel your popliteal pulses. Those are both normal at 2+. Your posterior tibialis pulses. And finally, your pedal pulses. There we go. And those are both normal. So now I'm going to assess your abdomen. So first I'm going to inspect it, looking for any masses, irregularity irregularities. Any pulsating, just anything like that. Next, I'm going to auscultate your stomach, check your bowel sounds. And those are all active as usual. And then his umbilicus doesn't look inflamed, red, any issues with that. Next, I am going to percuss your abdomen. So I'm just going to take 2 fingers. Okay, those all sound normal. And now I'm going to palpate your stomach. Let me know if you have any tenderness. Okay, have you had any nausea or vomiting? Okay, now I'm going to do deeper palpation to feel any internal organs that are abnormal. Okay, and those are all normal as they should be. Now I'm going to do percussion in your chest area because I forgot to do that, so I'm going to go back and do it just to note any resonance, hyperresonance, just to make sure it's all normal, no fluid buildup in your lungs. Okay, if you could sit up one more time. You had any shortness of breath?
No.
All right. So, have you been urinating properly? Okay.
Yes.
When was your last bowel movement?
2 hours ago.
Okay. Perfect. So, he doesn't have issues with constipation or urinary frequency or anything like that. So now you can put your shirt back on. I would do the Rene test and the Weber test to check for those abnormalities, and then I would do a taste test to check that nerve. So now I'm going to check your eyes. So if you could just look ahead at the wall. I'm just going to shine a light into your eyes, check your pupils. So his pupils are bilaterally reactive and respond to light and accommodation. Could you look at my finger? I'm going to go in, follow my finger. Okay. Now we're going to go this way, this way, this way, this way, this way. Okay. His optic nerves or muscles are intact. Okay, so now we're going to do your musculoskeletal assessment. So if you could stand up for me, put your shoes back on. Okay, so could you walk in a line right here with your feet one in front of each other, just in a line for me. This is checking his balance. Okay. All right, perfect. Okay, so now could you come back here and stand right here for me? Turn. Okay, so close your eyes, put one foot in front of each other, and I'm gonna have you stand there for 10 seconds. This is Romberg's test to check his mental functioning according to his movement. Okay. All right. Now I'm going to have you walk for me. I'm going to check his gait to make sure it's appropriate, and it is. Okay. So now you can sit back down, and I'm going to test your joints and your muscles. So we already did the sternocleidomastoid. So now I'm gonna ask you to push your hands against my thing. All right, now pull back. Okay. Now I'm gonna do it to your legs. So try to squeeze in. Okay, perfect. Squeeze out. All right. Now I'm gonna have you roll your wrists. Okay. Now your fingers. Okay. Okay, I'm gonna try to push your fingers together. Can you push outward? Okay, perfect. Okay, now I'm gonna come down to your feet. All right, try to push against my fingers, or my hands. Okay, perfect. Now, do the same. Okay, now I'm gonna do the same to your knees. Try to push back on my hand. Perfect. Okay, this one. Okay, now do the opposite way. Okay, perfect. All right, so your hips look aligned. So could you move your foot in and out? Perfect, other side. Okay, perfect. So he doesn't seem to have any joint issues, contractures, anything of that sort. So now I'm going to check his spine, so you can just sit straight up. I'm gonna feel it for any abnormalities. His spine seems to be straight. His scapula seems to not be bulging or convexing at all. Now if you could stand up again, I'm gonna have you touch your toes as best as you can. You don't have to, okay. His spine still seems in line. Now I'm gonna have you roll your leg out like this. Okay, and now the other one. All right, so you can sit back down. And I think that this concludes my physical assessment. Thank you so much for your time.
Thank you.
And yes,